What is a stroke? The topics that we're going to go over is what is a stroke, signs and symptoms of stroke, how to perform the FAST test, and what is a TIA. What is a stroke? A stroke occurs when the brain can't get enough oxygen and important nutrients. This is usually because a blood clot or sudden bleed reduces the blood supply. What are the signs and symptoms of stroke in men and women? Signs of stroke can include drooping face, sudden numbness or weakness in the face, arm, or leg, especially in one side of the body, sudden confusion, trouble speaking, or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or lack of coordination, sudden severe headache with no known cause. If any of these symptoms, call 911 right away if you or someone else has any of these symptoms. What are the risk factors of having a stroke? Conditions that increase your risk for stroke are high blood pressure, high cholesterol, diabetes, atrial fib. Some lifestyle factors can also increase your risk for stroke, including smoking, unhealthy diet, inactive lifestyle, drinking alcohol. How to perform the FAST test. F. Face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T. Time. If you see any of these signs, call 911 right away. Note the time of when the first symptom appears. This information can help providers determine the best treatment for each person. Do not drive to the hospital or let someone else drive you. Or call 911 in the ambulance so the medical personnel can begin life saving treatment on the way to the emergency room. A transient ischemic attack, or TIA. What should I do to treat a transient ischemic attack, sometimes called mini stroke? If your stroke symptoms go away after a few minutes, you may have had a TIA, sometimes called a mini stroke. Although brief, a TIA is a sign of serious condition that will not go away without medical help. Unfortunately, because TIAs clear up, many people ignore them. But paying attention to a TIA can save your life. If you think you or someone you know had a TIA, tell a healthcare team about the symptoms right away. How is stroke diagnosed? Your doctor will ask you your symptoms and examine you. To diagnose a stroke, you will organize tests, including images of your brain. The tests may include a CT scan, an MRI scan, an angiogram, or ultrasound to find the blood clot and assess your blood flow. An electrocardiogram, ECG, to check your unusual heart rhythms, and blood tests. How do I lower my risk for having another stroke? If you have already had a stroke or TIA, it's more important to make your following lifestyle changes. Staying active. That helps you maintain a healthy weight, improve your health, improving your diet, a diet that is varied, high in fiber, fruits, nuts, vegetables, and healthy fats, but low in saturated fats and salt can help prevent stroke. Quit smoking. Smoking cigarettes doubles your risk of having a stroke. Avoid or reduce alcohol. Drinking alcohol increases your risk of stroke. In review, if you think someone may be having a stroke, act fast. Do the following test. F. Face. Ask a person to smile. Does one side of the face start to droop? A. Arms. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T. Time. If you see any of these signs, call 911 right away. Thank you.